Coronavirus COVID-19 mortality rate globally, China and in Europe. Globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. Initial estimate was 2%. Mortality rate in China as of February 20, 3.8% nationwide, 5.8% in Wuhan, 0.7% other areas reported by the NHC of China. As Europe has become the epicenter of the global coronavirus pandemic, Italy's fatality rate hovers around 10%. France's is around 5%. Germany's fatality rate so far, just 0.5%, is the world's lowest, by a long shot. Study providing a tentative mortality rate of 3%. Death rate among patients admitted to hospital, HFR, 15%. Days from first symptom to death, 14 days, range 6 to 41 days, and tended to be shorter among people of 70-year-old or above. For comparison, the case fatality rate with seasonal flu in the United States is less than 0.1%, 1 death per every 1,000 cases. Mortality rate for SARS was 10%, and for MERS 34%. How to calculate the mortality rate during an outbreak? The case fatality rate, CFR, represents the proportion of cases who eventually die from a disease. Once an epidemic has ended, it is calculated with the formula, deaths, cases. But while an epidemic is still ongoing, as it is the case with the current novel coronavirus outbreak, this formula is, at the very least, naive, and can be misleading if, at the time of analysis, the outcome is unknown for a non-negligible proportion of patients. In other words, current deaths belong to a total case figure of the past, not to the current case figure in which the outcome, recovery or death, of a proportion, the most recent cases, hasn't yet been determined.